Hey guys, thank you for visiting my channel, Medical Assistant with Miss K. I'm Kendra, aka Miss K. So today I'm going to do a quick lesson on procedural coding. One thing I realized from a question that I got in my group was that I never did this lesson, and I said that I was. So a while back, actually, it's been over a year and some change, maybe even a year and a half. I can't remember how. I know it's been a while. I did a video on diagnostic coding, and um, I said in that video that the next video I would do would be on procedural coding, and I realized I never did it. And I got a question in my group the other day that made me realize I never did that video. Someone had asked the difference between the two. The person, she's in school, and she was saying she was doing an assignment and she didn't know. She was, just confused about the difference between the two. And as I was explaining it to her, I linked my video for the diagnostic code, and I said, oh wow, I realized I never did that video. So I got some time. I said, let me go ahead and do it. So I want to talk about, the difference between the CPT coding, which is the procedural coding, versus when we are versus the diagnosis codes. Okay, so you have diagnosis codes, which we talked about in the last video, and I'll link that video along with this one just in case you haven't seen it. You may want to watch that one first, but if you're already here, don't worry about it. You can watch it after this one. But the diagnosis codes, that tells the insurance company why the doctor or provider did what they did, right? So let me just first kind of rewind up just a little bit. So you guys probably already learned about the claim form, right? So we fill out a claim form to get reimbursed by the insurance company so that the provider can get reimbursed, aka paid by the insurance company, right? So the codes we use in place of writing out, word for word what the doctor did and why, we use these codes in place of that. Okay. So in that last video, we talked about diagnosis codes. We talked about why diagnosis codes, aka ICD-10 codes, explains to the insurance company why. So ICD-10 codes, that can be a symptom, right? Or it could just simply be a reason, like a symptom like chest pain or headache, or it could be a reason, maybe even family history, like the cardiology office that I work in PRNs. Sometimes patients come in, they don't have any symptoms at all. Like their actual reason for coming in is just because they have a family history of heart disease. Okay. And that is a diagnosis code in itself. All right. So let's get into it. So let's talk about procedural coding. All right. So there are two. So we have the CPT-4 manual, and then we have the HCPCS manual. So there are two manuals that we use for procedural coding. Now the HCPCS code that you see that we say, you might be saying, what in the world is a HCPCS code? Well, the HCPCS code, that's just short for the Healthcare Common Procedural Coding System, but we say HCPCS just because it's just easier to remember, right? So that is those are procedural codes as well. And they are used for first of all, Medicare patients have to use those codes, and then also for durable medical equipment. So those are also procedure codes. We also use those codes if the codes that we're looking for can't be found in the CPT-4 manual. Okay. All right. So if we look here, we see that there are 5 digits in the CPT code. So there are 5 digits. And let me just say, all of this is exam information. You need to know these for the exam. Okay. So if you're taking like the CCMA, any exam, really, any of the, even the CMAA, the administrative exams, RMA, CMA, you need to know this information for all of them. But anyway, so procedure codes are 5 digits long. So when you see that question, how many digits? 5 digits. Okay. Now, if we need to add more information about the procedure, we'll add modifiers. Okay. These are 2-digit code. Those are 2 digits. Okay. Those are modifiers. So that adds more information about the procedure. So as it says here, it may indicate the complexity of the service or note what part of the service was performed. The modifier may increase or decrease the amount or level of reimbursement owed to the practice. And let me just say this, procedure codes, they are what determines how much the provider is paid, right? So the diagnosis codes, again, that tells an insurance company why something was done, but it doesn't determine how much the provider gets paid. The procedural coding does. And as medical assistants, really, we don't go too deep into procedural coding or diagnosis coding, because you have to go into a billing and coding program, and you'll get more into detail. But we do scratch the surface, we barely scratch the surface, really. Everything that I'm explaining to you here and in that other video is what you need to know. However, if you are interested in coding, I do get a lot of students who are, moving into the billing and coding program once they finish my class. That's perfectly fine. It is a great field to be in. I just wanted to mention that in case, once we get through, this is a quick lesson in case you may have more questions. I don't go into detail. I don't get deep with it. Just literally just scratching the surface a little bit. All right, but anyway, I think the last thing that I mentioned was that the modifiers and what they do. Okay. All right. So I think that's it on this page. So an example of a diagnostic procedure, and notice I said diagnostic codes or diagnosis codes. So diagnostic code, and it's just the same thing. So but not to be confused with a diagnostic procedure. Okay. Now, a diagnostic procedure is not the same thing as a diagnosis code. Okay. The diagnosis is, of course, what the physician has, diagnosed the patient with, his or her assessment of the patient, right? Or like I said, it could be a reason. So a diagnostic procedure, those are used to diagnose a patient. So like as listed here, X-rays and MRIs, those are used to determine if something is wrong. Like X-ray, they may do to see if the patient has broken bones, right? So these are diagnostic procedures, meaning they are procedures that are done to help the physician diagnose the patient, okay? One thing I was getting to that I kind of forgot. So the CPT codes, they determine the amount that the provider is paid, because the more complex the procedure is, the more the physician is going to be paid. Obviously, if a patient comes in and they are just getting maybe they're just there for a follow-up. They were there, they're just there to get lab results. That's a quick visit, right? So their provider is not going to charge as much as he would if the patient is there for a full out diagnostic procedure, right? Or if the patient has to get some comprehensive work done, right? And those are actually now that I'm thinking about it, I think I'm going to try to pull up an encounter form so I can show you guys a difference, because you'll see that there's a difference in each visit type. Like one is like problem focused, and you have comprehensive and expanded detailed. And so once I pull up the encounter form, you'll see how you can literally the provider does this. The provider will literally just check off how long the visit was, what he or she did, and then we will just transfer that information to the claim form. But anyway, let's keep it moving. I wanted this to be really quick. So again, insurance companies, they use the procedure codes to determine reimbursement levels. And this is just letting us know that the code has to relate to the diagnostic code or the diagnosis code. For an example, if a patient is getting a chest x-ray done, let's just say the patient's getting a chest x-ray done in the office, and the diagnosis code is a headache, the insurance company is going to be like, what? It has to make sense. They have to relate. So if the patient is getting a chest x-ray done, it has to relate. Maybe they had a positive PPD. Maybe they are suspected of having pneumonia, right? So it has to make sense, okay? And it also just says insurance carriers also want to be sure that the procedure was coded correctly. Sometimes further documentation will be needed. So there are times where we have had to send copies of the progress notes to the insurance company, because let's just be real. The insurance companies, they will, if you miss something, they will deny it. So you want to be as detailed as possible. You want to code correctly, first of all, and you want to make sure it is as specific as possible. And then if you need to provide any further details, like copies of the progress notes or labs, you can do that. All right, so HCPCS code. So I said we got two types of we have the two types procedural coding. I don't know if you guys can see that pop up that just popped up on my screen. Hopefully not. We have HCPCS, and we have HCPCS is organized into 3 levels. We have the level 1 CPT 4, right? That's the current procedural terminology coding. And then we have the level 2 HCPCS national codes. Now, level 2 is what I mentioned earlier. Those are the codes that we use if it's not found in the CPT manual, and also if we're coding for prescription drugs and durable medical equipment, also required on Medicare and Medicaid claims. Okay. Um, Now, if you happen to be coding CPT, if you're doing some coding and you're looking for your CPT code and it's not in the CPT4 manual, then you can look into the HCPCS manual. All right, so there's 4 parts to the CPT4, the CPT manual. You have the introduction, the 6 main sections, 13 appendices, and then the index, okay? So when we're going to go look for a code, we're going to start in the index, but we always want to go and cross-reference it in the main section because the index is only going to, a lot of times in an index, is going to give us maybe a range. It may not even be a specific code. It may give you a range of codes, and then you have to go look in the main section for the actual code. So we got 6 sections inside the main body. We have E&M, anesthesia, surgery, radiology, pathology, and laboratory and medicine. Now, E&M, if you're working in a provider's office, this is going to be the ones that we mostly use. So the E&M codes, it lets us know the place of service, the patient status, and the level of service provided. These are all things that the insurance company need to know. So the place of service, of course, that's self-explanatory where it happened. The patient status is whether they are new or an established patient. Okay, so once a patient has been seen before, they are considered established. And then the level of service, as I mentioned earlier, like what all went into the visit, like how complex was the visit or how easy the visit was. All right, so the CPT4 has 13 appendices. As you can see here, we're not going to get into all of those. Again, if you're getting into coding, you'll get into all of these things that we'll see here. As I mentioned, the index is saying here is that's the place that we're going to look first, okay? So that's the first place the assistant should look for appropriate procedural codes. However, coding should never come from the index alone. The code or code ranges provided in the index should always be cross-referenced in the main section. So once we find a code in the index, we're going to go to the main section and we're going to just double check. Cross-reference just means we're going to make sure that code is the same. Okay, so if you go in the index and your code is, I'm just throwing one out here, 96045, you want to go to the main section and then make sure that code is the same. Okay. And I'll just read a little bit of this here, but the CPT4 index looks kind of like a phone book. It's laid out in columns organized alphabetically by main terms. For many main terms, there may be a subterm, okay, and then it underneath. So let me get an example of that. So a subterm may just get more specific, maybe like, let's say like maybe the arm, maybe the subterm would be, forearm or, anterior arm or maybe posterior arm. It'll just be more specific. But once you guys get into coding and you get into the books, you'll see it. All right, so the first place again is the index. We already said that. And I mentioned in that last book, and I'm sorry, not the last book, the last lesson, the ICD-10 lesson, that you want to look in the index first and you're going to cross-reference it. It's just they are both similar in that way. Okay. So there are 4 types of main terms that can be found in the index. You have the procedure service, anatomic site, condition, synonyms, eponyms, and abbreviations. Now, one thing I would say that's different from the ICD-10 coding, one thing I mentioned in that video is that when you're looking for a ICD-10 code, you're not going to search by the anatomic site. You're going to search by the condition. So like for an example, like chest pain, let's say you're coding chest pain. When you're looking in the ICD-10 manual, the diagnostic code manual, you're not going to go look for chest. You're going to look for pain and then keep looking, and then you're going to find chest. Okay. Whereas with CPT code, and you can go and look for chest, right? So you can go, let's say chest x-ray. You can go and you can look up chest as a term to go find chest x-ray. Okay. So that is something that you may be asked on your exam. So that's just something just to know. So CPT codes, you can look by the anatomic site. ICD-10 codes, you have to look by the condition and then find the anatomic site. All right. So this is just mentioning the subterms, and just a reminder to to always cross-reference. I'm noticing these slides are kind of repetitive. But anyway, so this is the format of the CPT for manual. So again, if you get into coding, you'll see that. So these are just some a legend here to let you know the code. So like for an example, if an N word, if there's a symbol there with the two triangles facing inward, that means that that code has recently been revised, or if it has a circle next to it, it means it's recently been added. So again, this is one of those things that if you do decide to take the coding class, you can do that. And you know what? I actually follow a lady on here on YouTube. I'll link her video. She gets into coding. I believe she's an instructor, but she has some really good videos for anybody that is interested in getting deeper into coding as well as billing. All right, so again, I said they can be anatomic sites. The main term that you look for can be anatomic sites. So this is an example of how the CPT for manual looks. Okay. Modifiers again. Now, let me point this out because this is important when you take that certification. Modifiers in the CPT-4 manual have a different purpose than the modifiers in ICD-10. They do not further specify what the procedure is. Okay, so ICD-10 modifiers, they make the diagnosis code more specific. Okay, they make it more specific. So, and I mentioned that in that last video. Modifiers for a CPT code, though, it adds more information. So make sure you know that. And it may kind of sound redundant, like you're still adding something to add more information, which is kind of true in a way. However, the question is there. Like if you see that question, you need to know the difference between the two. Okay, so the modifiers for CPT adds more information. Okay, so you add a modifier if a procedure was performed by more than one physician, if it was performed in more than one place, any unusual events occur, like let's say the patient had anesthesia and they, got a reaction to it, any unusual events, any extra information, any special circumstances is what modifiers do. And this is an example of how the modifiers look. So you'll have the 5 codes, you'll have the section so you can, write in the codes, and then you will add the 5 digits for your CPT code, and then there'll be a section for the modifiers, and I'll show you that on the encounter form in a moment. And I believe I do have a video showing you guys that, but I'll just show it here since I mentioned it. And then the level 2 HCPCS is structure like the other manuals, with the main sections, the index, and then the table of drugs. Okay. So again, they're used for durable medical equipment. Okay. All right. So down coding. What is down coding? Down coding happens when, let's say you send a claim form to an insurance company and you were vague or ambiguous, like they don't know what it wasn't specific, so they don't actually know. They'll down code it before they do anything else. That means that they're reducing it to its most basic form. And guess what? The provider is not going to get paid what they would have gotten paid if it was coded correctly. So you want to make sure you code as specific as possible, right? And then again, add your modifiers if you need to. Okay. The physician will lose money and the office will lose money. So be careful with that. And the procedures for performing procedure coding, you just want to prepare, make sure you have your manual, right? Determine a procedure, use your CPT-4 to find it. And what they're saying here when they're telling us to prepare, they're telling us to gather the supplies, right? Like your encounter form. And the great thing is that depending on where you work, you probably won't ever even have to use your manuals because your provider is going to always code it. But let's just say you work in an office where your provider leaves that up to you. My very first job was in a GYN office. It was a private office. Our provider, she actually left that up to us. I mean, because she did the same things over and over, we automatically knew the codes. Now, if there was something she did that wasn't, routine, then we would have to go look in the manual. For the most part, we were literally coding for her, and so that was my very first job. And I also got an experience with coding, right? Whereas every other job I had after that, I never had to code again. So I'm glad that I did get that experience. I can tell you guys, about it. But It would just be a matter of going into the CPT code manual and the CPT-4 or the ICD-10. Back then it was called ICD-9. But it would just be a matter of looking for the code, looking at her notes and see what she put in there. Also, I had to do some coding when I worked for a laboratory company. When patients would come in with an order, sometimes the provider wouldn't even put the numerical code there. They would just, the diagnosis code. They wouldn't even put the actual code. They would just write it in, and we had to find the code. And sometimes even like we would have to call the office and get the order and get the exact code. And if not, we just kind of had to use an ambiguous code, so but anyway, so prepare the procedure, gather your supplies, the notes, super bill, whatever you need, the manuals, determine the procedure, use the ICD-10. You got to get your diagnosis codes, right? And then assign the code. And then you have it. Then you're going to fill out the claim form and you're going to send it to an insurance company and hopefully get paid, right? Okay. So guys, let me show you guys the diagnosis code. Let me see if I can pause this for 1 second. Okay, so I wanted to show you guys the encounter, like I said, and hopefully you can see it. I know I do have a video on here where I go into detail, but since I'm talking about the codes, I wanted to just show you this. So as I mentioned, we will use the encounter to fill out the claim form. So basically the encounter, this is an example of an OBGYN encounter. Now, wherever you work, the encounter is going to be just for your specialty. So it's going to have all the common ICD-10 codes and CPT codes that your office use. So it's pre-printed. Everything is there. And if you happen to get a code that's not there, the provider ends up doing something that's not on there, you can simply write it in. But anyway, so remember when I talked about, the level of service and all of that, this is where you will indicate that here. So notice here, so the provider will fill this out though. Again, unless you're working somewhere where you're doing it. So this is where the provider will, or you will put what they did, right? And literally all you're doing, you're just transferring this information to the claim form, right? You're using, and that's actually a test question, exam question. Like, what do you use to ensure accurate billing? What form do you use? That's going to be the encounter form to ensure accurate billing. Okay. Most people get the encounter claim and claim form mixed up. That's why I did that video showing the difference between the two. And I will link that video below as well. But anyway, so these are the procedures here. So the provider will mark off the procedures that they did. And then we come down here. Here are the diagnosis codes. Now, these are all the common diagnoses that relate to that practice that you're working in. So again, it's all pre-printed. And if there's anything that's not here that your provider ends up coding, they're going to write it in here. All right. So I hope that this was helpful. Just a quick lesson. It's not a lot really. Those slides are one of the slides that I used when I was teaching the medical office class. And so straight to the point, really quick. Again, if you want to get into billing and coding, it's a great field to get in. I know people who have their own billing practice where they actually, they are contracted with different offices and they're doing it themselves and making good money. I actually have a cousin that do it as well. So definitely a good field to get into. I'll link that other channel's video here. Let me know if you guys have any questions about this. Hopefully it helped. I more so, like I said, wanted to go through this quickly because I realized that I hadn't addressed it. And then I want to make sure before you guys take this test that you know the difference between the two, because I got that question in my group, like I said. And if you aren't in my group, it's on Facebook. It's called the Medical Assistant Lounge. Make sure you answer the questions to be automatically approved into the group. But I noticed I got that question. And I noticed I've gotten that question a couple of times on my YouTube channel. So make sure you check out that ICD-10 video if you haven't already. So let me know if you have any questions down below. Feel free to email me as well. That is also down below. Feel free to schedule a one-on-one session if you need to. Thank you for visiting my channel. Be blessed.